cepacia complex, including treatment and clinical relevance. Question 1. Clinical presentation and risk factor. A 19-year-old woman with cystic fibrosis presents with fever, productive cough, and increasing dyspnea. Sputum cultures reveal a gram-negative, catalase-positive rod that is aerobic and highly resistant to multiple antibiotics. Which of the following statements about this organism is correct? A. It is typically sensitive to penicillin. B. It is associated with favorable outcomes after lung transplantation. C. It poses a high risk of infection in patients with underlying lung disease. D. It is an obligate anaerobe. Correct answer, C. It poses a high risk of infection in patients with underlying lung disease. Rationale: Burkholderia cepacia complex is aerobic, catalase positive, gram negative, and highly resistant to antibiotics. It causes severe infections in patients with cystic fibrosis or chronic granulomatous disease. A is incorrect. It is often multi-drug resistant, including to penicillin. B is incorrect. Infection is a contraindication to lung transplant due to poor outcomes. D is incorrect. It is aerobic, not anaerobic. Question 2. Treatment and transplant consideration. A 25-year-old man with advanced cystic fibrosis is being evaluated for lung transplantation. His sputum cultures repeatedly grow Burkholderia cepacia complex. Which of the following is the most likely implication? A. Proceed with transplantation and start cefazolin postoperatively. B. Burkholderia infection improves with standard dual therapy. C. The infection is a relative contraindication due to poor transplant outcomes. D. Oral amoxicillin is preferred for long-term suppression. Correct answer C. The infection is a relative contraindication due to poor transplant outcomes. Rationale: Burkholderia cepacia infection is a relative contraindication to lung transplantation, especially in cystic fibrosis patients, due to high morbidity and mortality post-transplant. A, B, and D are incorrect. The organism is highly drug-resistant, and standard therapies are often ineffective. Would you like questions on Pseudomonas?